From the Toronto Star, I'm Saba Itazaz, and this matters. Financial worries, work from home mishaps, pandemic isolation. Just as many of us were getting used to the new normal, we might soon be returning to the old normal. After nearly 2 years of working from home and navigating a Zoom window-sized reality, we now find ourselves looking at the very real prospect of returning to offices. Recent data released by global management consulting firm McKinsey and Company has shown that COVID-19 has profoundly impacted employees' well-being, with almost one-third reporting anxiety, while at least 28% have experienced burnout. Working women, especially racialized women, were the hardest hit. Their participation in the workforce was at a historic low. They were more overwhelmed with primary childcare. According to McKinsey and Company, 3 groups reported distinct challenges during the COVID-19 pandemic that were driving them to consider downshifting or leaving their careers even. Mothers, senior-level women, and Black women. Kana Enomoto, a senior expert at McKinsey and Company, is on today's episode to talk about what it looks like when employees get ready to come back to the office with all the trauma, exhaustion, and grief of the past year and a half, and what employers will need to change to make this work for everyone. Hi, Kana. Thanks so much for joining me on the podcast today.
Hi, Saba. It's so great to be here today. Thank you very much.
So, Kana, we've seen how COVID-19 has impacted employees' well-being, and we've also seen the disproportionate impact of that on women, particularly racialized women. And you speak about that in your recent report. There's a lot of troubling statistics mentioned. Can you tell us more about the numbers that stood out for you?
Absolutely. It is really alarming, and it is so important for employers and really for all of us to be mindful of the mental health implications that COVID has had, as well as the return to work prospect. So in our work at McKinsey Center for Societal Benefit through Healthcare, we've seen that almost a third of people we survey who are full-time employed individuals have anxiety. They're anxious about layoffs and furloughs. They're anxious about returning to the workplace and their safety for themselves, as well as the safety of their loved ones. They're also expressing a lot of concern. 20% of people are reporting concern about stress over childcare, and 28% of people are talking about burnout. So this is a lot of stress that we're seeing, with 40 to 43% of adults having symptoms of anxiety and depression. So it's really incumbent on employers to think about this, and we see even greater impacts on women.
Right. And you also mentioned senior level women, mothers, and particularly Black women. And we'll go into that as well. But the obstacles that we're talking about, and now we see almost every working woman facing them through this pandemic. Do you feel like the pandemic has amplified and shed a light on what underrepresented and racialized women have already and always been struggling with, even before COVID?
Yes, absolutely. So, right, you mentioned women in senior level jobs who have felt like they needed to work harder than men, have different kinds of judgments and expectations, as well as home responsibilities, are burning out at a higher rate. So 39% of women during COVID senior women are reporting feelings of burnout relative to 28% of men. And Black women in particular are feeling less support from managers and experience both microaggressions as well as acute and overt discrimination at work. And so for Black women, they're grappling with the toll of the systemic and highly publicized violence that we've seen toward the Black community in the United States and globally, and the disproportionate impact of the pandemic on Black Americans. So we are absolutely seeing that Black women are 1.7 times more likely to say they don't have a strong ally on their team. They don't feel like they have someone that they can go talk to, they can share their concerns with at work. And this creates an environment that doesn't necessarily feel psychologically safe or welcoming. So for Black women in particular, they have especially long faced challenges in the workplace. And half of all Black women report that they are an only in their workplace. So they're the only woman and the only Black woman in their work group. And so that makes it a less supportive environment where they feel uncomfortable talking with colleagues about their own grief and loss. And they're less likely to say they can bring their whole selves to work, which, as we all know, is so important for us to have our work lives be sustainable and enjoyable and a place for rejuvenation rather than drain.
Right, and all of which has gotten worse during this time. One of the solutions you talk about in your report is the need for employers to prioritize mental health. What are some of the ways they can do that?
That's a great question. And it is so exciting to see more employers than ever asking these questions. So, in a recent survey that we did, 9 out of 10 employers felt that COVID was having a negative impact on their employees' mental health and on their employees' productivity. And so, about 70% of employers said that they were taking actions. And the kinds of actions that they can take are making mental health a priority, appointing somebody in their firm to be the spokesperson and to be responsible and accountable for addressing the mental health needs of their employees. You can communicate more. You can have senior managers and mid-level managers communicate about the commitment to employee mental health, as well as backing that up with significant action. Taking steps to ensure people feel more comfortable, seeking the support that they need, and that people know what resources are available to them. You can reevaluate workplace norms. You can make sure that people don't necessarily feel like, especially during COVID, that there are no clear lines between work and home, people feeling like they're always on. If that's happening, people need to address that. It's particularly true for working mothers. Companies can also enhance their mental health supports, making sure that people have access, that know the services and the supports that they have access to, whether that's through their health benefits or through their employee assistance program or their EAP, whether they have sort of free counseling or other digital tools, self-help tools, telehealth, or employee interest groups or resource groups where they can get support.
We'll be right back. I want to focus on that demographic in particular. You mentioned working mothers and you narrated down as them having a particularly difficult time, especially with work-life balance and a feeling of always being on the clock as parents during this lockdown. So, what are some of the specific ways that employers can help them now as they prepare to actually head back into offices?
Yes, 1 in 2 respondents of our surveys with children at home indicate that returning to the workplace will have a negative impact on their mental health. So it is really important and really essential for employers to take this into consideration, that a sustainable pace of work will be essential to helping working mothers prevent burnout, and the transition back to the workplace will be smoother. In addition, women and other parents are concerned about losing flexibilities that they had during COVID to address their family's needs. And so companies can look for ways to reestablish norms that allow people to take care of their family obligations while still meeting all of their work obligations. And then looking at work-life boundaries and communicating which of those workplace flexibilities will continue to be available and how the company is going to take a clear stance on ensuring that people take their time off. So, for example, really expressing that when time off is time off, or that we really want people to take these days for rest, or that we're going to set certain times after which we won't be expecting people to answer phone calls or check email or check Slack or have meetings. So all of these, I think, will be really helpful for companies that are trying to support those parents who are coming back to the workplace.
Right. And like you said, if you just normalize it and if that kind of communication and openness comes from the leadership, it's a lot easier for people to ask for and admit that they need time off. Let's talk about burnout. Your research mentions that senior level women are more likely to experience it along with mothers and Black women. Can you talk a little bit about what you found?
Yes, it's really telling that our women are 50% more likely than men to be feeling burnout. And Black women in particular are feeling higher rates of burnout. And so we know that we are forcing people to balance their work responsibilities with their family responsibilities, and then in an environment in which they don't always feel welcome or they don't really feel the permission to share their concerns. And so one of the important things, you mentioned it, is that leadership really needs to be clear and communicate that it's okay for people to press the pause button. It's okay for people to say, this is really too much for me. And that the organization is going to be there to support those workers who say that they are overburdened and that they need to take a look at the pace and the expectations that have been placed upon them. In addition to that, I think the companies need to look at their workplace norms and their cultures. How are we staffing things? Are we placing burdens that are unreasonable or unsustainable? Because really in the long run, it seems like we're pressed at the moment to achieve so much, but over time, we know that if we have people burning out, we're not going to be able to sustain.
Like you mentioned, there's such a challenge for women, especially racialized women, in accessing this care as well. And we talked about some of the damaging stigmatization and stereotyping that people of color tend to face and how that can be changed if employers step up. Let's talk about the employees themselves. You mentioned a lot of employees are not aware of what might be available in terms of help and resources. So, what can be done about that?
Yeah, you're absolutely right. So, about 71% of employers in our survey who have frontline employees report that they are supporting mental health of their employees very well or well. And interestingly, 27% of frontline employees that we surveyed agree that their mental health needs are being supported well or very well. And many employers report that improving access to substance use disorder treatment and mental health services is a priority. But, we see a minority of employers that are really focusing on increasing access, whereas employees, so 8 out of 10 employees who is struggling with a substance use disorder with themselves or their families, they report that it's challenging to access care. And 2/3 of people struggling with mental illness report that it is challenging for them to access care. And so employers really need to make sure that they are messaging from the top and in multiple channels that what services are available, how they're available, and how employees can access them, as well as that whether or not employees will have the time to access them. So, for example, is whether they have paid time off and that would be considered a reasonable use of that. So I think it's, that what are the mental health benefits, the core benefits, what are the additional mental health benefits, free counseling through their EAP programs, and what are the workplace mental health programs that they're offering. And again, it's communicating it consistently and frequently and through multiple channels. And interestingly, we see that when you have different generations of employees, for example, Gen Z, the younger employees versus your millennials, the route in which they want to get that information is different. And so that's also important to understand your employees, how they want to get that information, and how they're most likely to be able to use it so that they can get their mental health and substance use needs met.
Right. And as we discuss the possible solutions and the structural changes that we might need to fix some of these problems, what will success look like? How do we know, let's say, a year from now, if things are changing and getting better? Because we know that this pandemic has really set back the clock on a lot of people, particularly working women.
I would love to see a world in which 9 out of 10 employees say, I work in a company that is stigma-free. Right now we have 1 in 10 employees saying they work in a company that's stigma-free as it comes to mental health and substance use. But, that can and should be reversed. Right? We can do better on that, and company executives can play a really important role in helping people understand that we are not judging these conditions in a way that is any different from how we treat other health conditions. Right? We have the same care, compassion, and urgency in helping all of our employees be their best selves and address their health. I think we would also see particular attention to gender-specific services and needs. What are the needs of women in particular who have been experiencing a greater burden of depression, anxiety, stress, and burnout through the pandemic? How are we addressing the needs of parents? I would love to see that parents who are juggling multiple responsibilities feel like they have the flexibility from their employer to be there for their families as well as be there for their work. And finally, that we would start to see more equitable, accessible care. Right now, we have 3 out of 4 employees who report being Hispanic or Latinx say it's challenging to access counseling. That is almost 10% more than their Black and white colleagues. So we should have a commitment to advancing health equity, and that includes evaluating and addressing the barriers to mental health care and to make sure that it's available in multiple languages and in ways that meet the cultural needs of our employees.
Kana, you've been so insightful. Thank you so much for your time.
All right. Thank you so much. It's been a great conversation. I appreciate it.
I was talking to Kana Enomoto. She's a senior expert at McKinsey and Company, where she co-leads the Center for Societal Benefits through Healthcare. She has more than 20 years of experience in mental health and substance use policy and was formerly an advisor to the U.S. Surgeon General. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mutter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.